All right. So just by way of introduction, my name is Lindsay Corcoran. I'm a senior consultant at Stroudwater Associates. We are a healthcare consulting firm, and I think some of you have worked with our firm before. I know that we've worked with the state office for a few years now, doing some various projects, and I'm sure you've interacted with our firm in some way, shape, or form. But I generally work with the rural hospitals, critical access hospitals, doing a lot of financial and operational improvement, as well as quality improvement and physician, and work with a lot of the physician practices as well. So this is a new project, and it's funded through the upcoming Flex grant. And so what I'm going to do is just add, this is a kind of a project overview. And really want to get your participation in what we're calling the Swing Bed Directory project. All right, so really this is it's going to be offered for all the rural hospitals that offer swing beds across the state. It's really an opportunity to leverage your swing bed program and utilize it and apply the Swing Bed Directory to increase volumes, expand services, and more effectively market your skilled care program at your hospital. In addition to helping you educate nurse managers and swing bed coordinators on the value that swing beds bring to your hospital and to your community, identify any opportunities to add services to the swing bed program, and learn from, and we'll have an opportunity to also kind of share amongst your peers. I think that is so valuable as a way that we can learn from each other. If somebody's doing something really great as it relates to swing beds, I don't think that is something that we need to recreate the wheel. And sharing of best practices is, I think, so essential. So there's going to be certainly an opportunity to learn and listen to a group of your peer rural hospitals. And then also this project is going to be able to kind of hardwire some of those marketing initiatives and ways that we can leverage our swing bed program and generate additional referrals to our hospitals. So just to point out, this is something that is no cost to your organization. It is sponsored through the Oklahoma Flex Grant and the State Office of Rural Health. So what is this Swing Bed Directory? Well, first, it's a web-based application, so it's completely online, and this will users are going to log in and make various selections as it relates within the database to your swing bed program. So it's kind of a self-evaluation about some of the services, the competencies, things that relate to your swing bed program. We want to know about it, and you're only going to have to enter this information one time. So, and then we're going to inventory that, and we call this the care delivery spectrum. So we want to know, and so what is this care delivery spectrum? And it's really this process of identifying what services, resources, staff are provided by hospitals, and understand where kind of the gaps in services deliveries may be, and where there's some opportunities where we can fill those gaps. And so by doing this kind of self-evaluation, we're going to help work through, what are some of the bright spots within your programming, or where are some of the opportunities that you can maybe look to expand, grow your swing bed program. So again, it's web-based. Swing Bed Directory is going to serve as kind of this comprehensive portfolio of patient care services, and a chance for hospitals to identify the services they currently offer based on kind of those resources and staff. The goal is to really, it's kind of has a few different legs to it. We can use it for marketing. We can use it to define, who our potential partners are or referral sources, and then also expand services where possible. So these are some of the various kind of clinical programs that will be reviewed as it relates to your swing bed program. So, and I'm not going to go through all of it, but you'll see that, we touch on many different clinical programs. Some you may offer within your swing bed program, some you may be interested in about expanding to. So we're going to want to know kind of where you are as it relates to some of these clinical programs. In addition to those clinical programs, we want to know about the resource requirements for each of them. So kind of what are the care and nursing competencies, which, may include, hey, we have a certified wound care nurse. Well, we want to know about that. What about different equipment that you may have? Maybe you have bariatric beds and you're able to take bariatric patients within your swing bed. You guys just talked about ventilators. Well, we want to know, do you have ventilators that can support, a swing bed patient, or, think of it as that admission, and support services. So whether you have discharge planning, what are your specialty provider supports, what's the rehab complement, are you offering OT, PT and speech, or just PT, what are some of those support services? So that's some of the things that would be included in that self-evaluation. And so really, why participate? Well, and I apologize that this is probably going to be way too small for you to see on your screen, but you are going to be getting all these slides, so you can certainly take a look at it on your own time. But this is all the rural hospitals in Oklahoma, and it's looking at whether or not, from a swing bed average daily census, whether or not you kind of meet this established target. And this established target is relative to your population. So we put it, and this is just to kind of see where you are relative to peers. And this established target is of an ADC of 4 per 10,000 population, so 10,000 people. And then that you either are above or below that target. So clearly, we have a lot of utilization varied across the state, and I think that showing that kind of data gives us an opportunity that we can leverage to kind of increase our swing bed volume. So, and we think that utilizing the swing bed directory will help do so. And so, why else? Why participate in this project? By participating in the swing bed directory, there's going to be a few benefits to your organization, and some of those will include, the ability to identify clinical, operational, and infrastructure barriers. So, what's prohibiting you from increasing your swing bed volume? And so we're going to want to know, we're going to be able to kind of work through some of those and understand that. Looking at some of the gaps, whether it's patient care, whether it's clinical competencies, that may be prohibiting some of those growth opportunities. And those gaps being whether or not that maybe it's a service gap, where you're not providing that service, but you can adequately provide that service. So that may be another opportunity where we can grow our swing bed program. And then like I said before, an opportunity to participate in kind of peer-to-peer sharing amongst a cohort of hospitals for information exchange, knowledge exchange. And I think it's so vitally important to do that. So within this project, you'll have that opportunity. And then be included in what we're calling a statewide transfer opportunity tool. So this is almost kind of the kind of the handout tool that you're going to be able to, or the marketing tool that you will be able to utilize to your referring hospitals. So it's going to be kind of a high gloss, fancy dancy marketing tool that you can give to your referring hospitals, so they'll understand what are the services that we offer, what are the kind of patients that we can take into our swing bed program, whether we have 24-hour respiratory therapy or we have 24/7 case management. What are some of the highlights that we can share with our referring hospitals to kind of build on those referrals. And then I don't think we can talk about swing bed and have a conversation about, you know, healthcare in general without talking about COVID-19 and the pandemic that we're currently in. We at Stroudwater really think that swing bed services remain a vital resource during this pandemic, whether it's to, you know, if you're a rural hospital and close to, you know, a more urban hospital that's experiencing surges, you know, there's certainly value in getting some of those patients out of the more urban area and supporting our healthcare system through the swing bed program. And I do want to leave you with a kind of a case study. And this is really about where a hospital kind of grasped and leveraged their swing bed program. So a critical access hospital in rural Georgia, negative operating margin in 2017, swing bed ADC of 1.1 days. So where are they today? Well, since, you know, 2017, they've implemented new leadership. They have new leadership. There's a renewed focus on growth and importance of swing beds. They had, specific to their swing bed program, they replaced their rehab group. They implemented a ventilator and a trach program, and they partnered with another rural hospital that had a similar program to act as kind of that referral source. Since implementing this ventilator and trach program, they've increased their swing bed ADC to 7.4 days in 2020, and they continue to have a goal of about 10 patients per day in their swing bed. So the reason I kind of leave that is, or share that with you, is that I think we have an opportunity with swing beds in hospitals to kind of maybe it's finding our niche market where we can, you know, offer a service that maybe not offered elsewhere. And that's one of the opportunities to grow our swing bed, is to kind of find that niche market and leverage swing beds that way, as a for instance. So in my last slide, it's sort of an ask. And in speaking with Laura and her team, think that, you know, having a steering committee would be certainly beneficial to this project, and I love the idea. And what I envision the steering committee doing and helping, if you'd like to participate, is meeting on a quarterly basis. We can certainly meet more frequently if that's the case, but at least on a quarterly basis. And really the steering committee would help provide insight to any barrier, strengths, issues related to swing bed optimization, and really serves as an opportunity to help me as a consultant to really kind of develop swing bed education content, because this project will also, you know, have a kind of an education information sharing arm to it, as well as the actual kind of directory and that web-based tool. But an opportunity to, you know, steer and make sure that the education content is what you need, what you want, and really specific to you all. So, you know, more customizable. So certainly the steering committee, that is my hope for that. So feel free. I'm going to have my contact information. You will be receiving the slides from Laura, and feel free to email me with any questions that you have if you'd like to participate in the steering committee. We need, you know, just a handful of folks for that steering committee, but I'm really looking forward to getting to know you all a little bit more and more about your organizations, and hopefully we can get those swing bed programs ramped up.
Thank you, Lindsay. Does anyone have any questions for Lindsay? Lindsay, I had a question for you.
Sure.
Thinking about the steering committee, how soon did you want to meet to have that?
I think we can meet. We can start either in the next 2 weeks if we have a cohort of folks that want to participate, and we can start laying out plans for the rest of the year, or we can start next month. You know, I'm up for anything.
Okay. So if you guys are interested in being part of the steering committee, which we would meet before the program officially kicks off, let me know in the next couple of weeks and we can definitely get something set up. I know I was looking through the list of attendees today. There are no prerequisites to being on the steering committee. You don't have to be in your position so many years or have so much experience. We just really want your feedback on what you see in your facility. So with that said, please, yeah, if you want to, please let me know and we'll get a meeting set up. And then after that, we'll have more forthcoming information moving forward with the project, right, Lindsay?
Yes, absolutely.
Okay.
Yep. And so our next kind of webinar kind of education training for folks that are going to be participating in the project would be, okay, how do you use the tool? When we log on to this web-based tool, what are the steps? Click here, do this, that will be the component.
And then I did have a question from an individual. How do they sign up to participate in the program? We'll be sending out a lot of information, a lot of emails, and you just show up, right? Or
yeah.
What type of commitment, I guess, are we looking for?
Yeah, no, I think it's going to be minimal in terms of what the ask is from the hospitals is to participate in the webinars. And I'm envisioning 3. We can certainly do, like maybe one per quarter. And also to kind of log in and do your self-assessment. And we're going to have ways that you can leverage this tool. We want to help you take this tool and use it to your best interest and use.
Okay. All right. So yes, let me know about if y'all want to be, who all wants to be on the steering committee. And I can also send another email out to everyone, to all quality directors, asking who would like to be part of the steering committee. And then please be looking for forthcoming information. We did have another question about dialysis regarding swing beds. And if anyone is doing dialysis for their swing bed patients. Teresa, I think Stroud does. And I can put you in touch with someone there. Is there anyone on our call right now that's doing dialysis for swing patients? And Lindsay, is that something you guys see in other states?
Yeah. No, I think it's not as prevalent for sure. I mean, I don't see a lot because a lot of communities will have, outpatient dialysis, for profits that are in their communities, and they're not doing dialysis in the swing bed.
Okay. I know dialysis is a tough one. And so Teresa, I will follow up with some of my contacts and see for sure if that's correct and get you in touch with someone. So are there any other questions for Lindsay? All right. Well, thank you, Lindsay, and good luck with the technicals.
Oh, yeah, you're welcome. And can't wait to work with you all. Thank you. Thanks for your time today.
Thank you. All right. Well, next up, we have Robin Carlson. She is with Arkita. She is our go-to person for all MBQIP questions, all quality-related questions, all questions we get, go to Robin. And so when I was talking with Robin about a month or so ago, well, it was right after our last submission into QualityNet, and I noticed that everyone had a variance of experiences where we already have our HARP account set up, but some folks were being told they need to go through HARP to log in to get their data submitted. Some folks were trying that, and then they said they didn't have all the options available to them. And so that really prompted a lot of questions with Robin of like, what are you hearing? What are you seeing? And the good news is we're not alone. The other states have been experiencing this. And so Robin is here to answer our questions and share her expertise regarding HARP and how we move forward. So Robin?
Hi, can you hear me?
Yes, we can.
Okay, I'm going to share my screen, and guys, I'm going to be, thanks for having me today. And let me start out by saying what I'm telling you or what we're talking about today is what I know as of today. I'm not quite I'm not quite sure why, but CMS hasn't put out any resources, any kind of educational information other than initially way back, maybe it was in April, saying that, hey, everybody had to have a HARP account and you had to get that. And I think they were pretty good about that. They had a webinar about it and the instructions were good, but that was it. And so it wasn't until people started submitting, and like Laura said, some people went in through their HARP account and everything was fine. Some people went in through their old secure portal account and that worked. Some people, nothing worked. So I'm going to tell you, like, and show you some of the things that I have found and some things that people have told me. And then, you know, anybody just like speak up in the chat or interrupt me if you have something to add or an experience that you want to share. So again, I want to say, if I had someone that I could bring on for you guys that would be the expert in this, I would do it, but there doesn't seem to be one. I have tried, I have to call QualityNet and ask these questions just like you guys do and get the same kind of often poor responses as you guys do. I've even tried calling the support, the outpatient support, and the contractor that CMS has for that, and they seem to know about as much as I do. So, you know, kind of we're all in this together, and I know maybe that doesn't help when you're trying to do your submission, but you aren't alone. And I'm going to say this now, and I'm going to try to remember to say it at the end, but I'm hoping that by the time data is due, again, now November 1st would be our next due date, they will have some more information out there. But regardless, as best as you can, do not wait until the last minute to submit. Because if there are the kind of issues that there were last quarter, I know some people didn't get their stuff in time, and we don't want that. So saying all that, I'm going to try not to bounce around, but I'm going to talk about things as I think about them. And so again, just stop me if you're like, you know, what is she talking about, or you can't understand me, okay? So I'm going to share my screen. Can everybody see right now the main QualityNet page?
Yes, we can.
Okay, so everybody should be pretty familiar with this page. What I want to show you is, everybody, please make sure and do this. The subscribe to email updates. Let me show you what that looks like. Okay, now even if you signed, oh, now this looks different today. Oh, this is so irritating. Okay, this is what I want, guys. Make sure you click on that, click on the private lists. You want to make sure that you have clicked on and signed up for CART notifications if you use the CART tool, but this is the biggie, these last two, HARP notifications and QualityNet notifications, because this is how CMS is going to send out information regarding any kind of education, any kind of updates to these accounts, or showing you what new things look like. So make sure you sign up, your name and your email. And I already did it earlier today because I was practicing looking at what these sites look like, because they seem to look different every time that I log in. So make sure you do these. And again, you know, if I find out things, I'll put them in my column in the MBQIP monthly, or we'll try to let you guys know, but this is how I find out about things. So if you guys are signed up to these listservs, you're going to find out the same time that I do. So I would really recommend that, these two for sure. And these are other lists about outpatient and other support, but it's not ready to sign up yet, so don't worry about those. But again, make sure you do these. Okay, so all right, I'm kind of looking at my notes because I want to make sure that I tell you what I know. So what happens if, like, I'm kind of guessing everybody signed up for the HARP account. Okay, I'm going to kind of go with that assumption, but in case you didn't, or even if you did, and all you know is, well, I just know this main page in QualityNet. This is the page I've always gone to. This is the page that I know. What do I do? Well, hopefully it'll come up faster, but okay, say you don't know what to do. So this is what you're familiar with, is logging into the portal. So I'm going to kind of go through this and show you like what happens. So I'm going to log into this portal like I used to do. and I want hospital quality reporting, okay? So it's gonna let me, now this should look like familiar to all you guys on how you used to do this. Okay, if I could spell my name right. Okay, my password for this. This is like the old way we used to sign in case like maybe you forgot or you didn't sign up for HARP yet. Okay, I need my security code. So if you remember, you do this VIP access thing. Okay, and my security code didn't go, so this is a good indication of what you might see here. Anybody has any questions while I'm doing this, just put them in the chat, or Laura can maybe monitor that. See, I'm just like you guys. I forget how to do these things. Okay, I want to paste, I want to submit, get this. Okay, so this is what it's going to tell me. Okay, if you've forgotten how to do the new HARP stuff, log in your old way. This is what it will tell you. Hey, we've got a new site now. This is it. It's telling me the records indicate I've already linked, I've already done my HARP account. Okay, so I would assume then if you hadn't, you wouldn't have this paragraph right here, and it would tell you to go here and give you the steps on signing up for the HARP account. But again, I wanted to show you in case you don't remember this. Now I've bookmarked this link, so I've got it. So it'd be a good idea if you can do that. But in case you somehow forget, you still can log in that old way and get to this site. So I've got my HARP account. I'm going to go here. Okay, I'm guessing everybody, well, I'm not going to guess. People are familiar with how to do this, but I'll show you. My password. So I'm going to log in. So this is the whole thing about the HARP accounts. It's this two-factor authentication rather than that VIP security thing we had before. Now, when I set up my account, I set it up to get an email notice. Okay, so I'm going to click on email, and now I'm waiting to get. I'm going to get my email to get my code. And I think you can set it up as a text or like a phone call, but for me, I wanted to do email. And if you ever didn't like how you were doing it, you could always change how you got your code. Okay, so here's my code. I'm going to continue. All right, then you get terms and conditions, got to scroll down, and then accept. Now, I want to stop here for a second because I will tell you guys, I have to start laughing. Until today, and I hadn't tried to log into HARP for a while, I got to this point and I could never get this to turn blue. I thought, okay, I'm not really reading this. I even read every line, scrolled down to the bottom. I could not get it to turn blue. I could not go farther than this step right here. I called the help desk multiple times, was on for almost an hour one time, and the only thing they could tell me was, you have to be in Chrome. That has to be your browser. I am in Chrome. Okay, so then their answer was, well, you've got to talk to your IT people. Well, my IT people didn't have any idea. The only thing we could think of was try a new browser. So for logging into HARP for me, I had to do it through a different browser. I had to do it through Edge. And then when I tried to log in through Edge, I got this blue, I could accept and go further. Now today, because I hadn't logged in for a while, I kind of forgot that I was in Chrome and this didn't work for me, but it worked today. So let me just kind of say, if you ever get to this spot and you can't get in, and I don't know how easy it is, and I'm not trying to make light of it. I mean, you know, in a hospital, maybe you don't have options to get a different browser, but that might be one thing to try. if you're having trouble, try to do all of this in a different browser. The QualityNet people will recommend Chrome, and I believe that works for most people, but not everybody. So that's one suggestion. If you're having trouble, try a different browser if you can. So I'm going to accept. And it's going to take me into the new reporting pages. Now, your guys should look different than this because you should have more options. I don't, and it says view the new quality reporting access. See, I don't have the options that you guys have because I'm not in a hospital. So I don't have all those choices. But this is where you would have the you know, for filling in, for submitting data, for managing your security. You guys have way more options here. But I just wanted to show you that was kind of the login process. And this is where this is where you would get to the site where you can then submit your data. Anybody have any questions to right now? And while I'm here, I want to remind you that this is the place, My Reports. This is where you can run that case status summary report that I always talk to you about. Like in my monthly columns, and maybe if you've contacted me for instructions before, this is where you can run that case status summary report to find out if your data actually got accepted. So that's off of this site. Any questions around this so far? And maybe it's nothing new to you guys. So, and that would be good too, that you guys have already gotten this far and you're okay, but just wanted to make sure. Okay, no questions. I want to now show you something new. All right, so I'm gonna go. I want to show you kind of what passed. Again, this is as far as I can get, but you're going to get to something else, and I want to show you screenshots for that. So forgive me if I mess up here, but I want to do this, new share. Okay. And this is a handout, and I will give Laura the link if you guys don't have this before, because this is not, this wasn't like a CMS resource. This was like a resource I got just out of the goodness of one of my Minnesota hospitals' hearts, because she had gone through this process and did some screenshots for me. And so I kind of tried to put this in something that would be available to you guys that would maybe help walk you through a little bit further than what I just went through. So this first part right here is just the how to sign in stuff again. Okay, how to sign in, blah, blah, blah. Showed you about this. This is what your screens would more than likely look like. You would have all these more boxes because you have more options than I do. Okay, and if you clicked on this one, the new reporting site, this is what you're going to get. This is kind of the site where you're going to pick to upload your records. Okay, now, so this is where I have not found any resource from CMS. This is like one of my hospitals who gave me screenshots of this page. So I want to preface with saying that I really apologize for that. My phone. This is what it looks like the last time that this person tried logging in and submitting her data. I believe that this is what it currently looks like. Okay. But I just want to tell you that, because all of a sudden, if you looked and it's nothing different, I'm sorry. This is like the up-to-date most information that I have. So you're going to want to, you know, after you've logged in, you've done all this, you're going to want to file upload. Okay, that's what you're going to do when you want to submit your data. Now, and maybe some of you guys have already figured this out or it's happened before, but when you click on file upload, you get this next screen right here. But it defaults to ECQM. Okay, now you're not submitting ECQM here. When you're submitting your data like through CART, you're submitting your chart abstracted data. You need to make sure it says chart abstracted. Okay, so make sure again that you pick what you're trying to do here. You are submitting chart abstracted data, because I know what happened as a fact. Some people told me they submitted their data and it was rejected. And then when we look to try to find out it was rejected, it's because they submitted it under the ECQM tab. Okay. So make sure you've clicked on chart abstracted. The next thing, okay, it's under chart abstracted. Under this submission, it says production or test. Now, I don't really know, I haven't been able to find out from anybody why they gave a test option. I guess it was if people wanted to practice, I don't know. But again, we had people who maybe didn't click on production. They submitted their files through test, but then their data was not accepted because it was submitted as test data. So what you want to do, and because this doesn't make any sense, but through trial and error, I have found from people, first click on change selection, then click on production. Because people clicked on production and they thought they were going through it the other way, and it turned out it reverted back to test. So get to this screen, make sure you've got chart abstracted, click on change selection, then pick production. And again, if anybody did any of this, has any trial or error or any thoughts, please feel free to let us know. Then I believe it says which program are you chart abstracting for. We're going to say outpatient quality reporting. And then you're going to select your files to submit. And then apparently you get this email confirmation saying that they've received your files like you did in the past. So that is as much information as I've been able to get so far about this. Now, the other thing I believe that's going to happen now, okay, because CMS sent out an email, not CMS, QualityNet, sent out an email, I want to say around August 14th or whatever, saying this is the way now that you have to submit data. It didn't give you any of this information. It basically just told you how to get to this page. You have to have a HARP account. You would have to click on and get to file upload. But I think this is how you're going to have to submit population and sampling as well. When you get to this, this page right here, and instead of doing chart abstracted, I believe you're going to have to click on population and sampling. And I have not been able to find anybody who's done that yet to get any screenshots. I called the QualityNet help desk. I spent, and I timed it, 54 minutes online with the people at the help desk, and no one understood what I was talking about and could not give me an example of what this page looked like. All I heard was, well, yeah, they should be putting out some instructions soon because the old stuff, the stuff that's out there is really old. And then I had to hang up because I thought my voice might be getting snotty, and I really did have something else to do since it was like on the phone for almost an hour. And I'm kind of making light of it, and I don't mean to, because it's really frustrating and I get it. I just want to let you guys know I am trying to find out this stuff for you, but I get kind of in the same roadblocks. It's just, I'm not the one who's not going to be able to get my data in, but I do get it, and I'm trying to find out things. But if someone has done population sampling and has shown what maybe some screenshots looks like, or if I can get some from somebody, I've got some feelers out there, I will make sure and put something together to let people know. But this is kind of what I know right now. Now, I've also had someone, back when I was talking about the browsers, I had someone try to do this one, and she even walked through people. She called QualityNet so many times. She started trying to submit her data beginning of July for August 1st. And she was in chart abstracted, and she had production, and the QualityNet people just thought, well, she probably just is submitting it through test. I mean, that, you know, and she's like, no, they walked through her. They couldn't figure out why she was getting rejected. And they sent her ticket up to a higher level and still couldn't figure it out. And she and I are talking, and I'm like, man, I don't know what to do. Did you try it in a different browser? Well, she tried all of this in Internet Explorer, and then her data got accepted. However, we talked about this after the first, so it was rejected because of the lateness, but at least it got to the warehouse, which was more than what happened before. So I want to say again, as much as a pain as that would be, if somehow you think you're trying all this and your data keeps saying it's rejected, you know, try to see if you can do it in another browser. That's the information that I've got available to me right now. Does anybody have like any questions or any comments or thoughts about what maybe worked for them or didn't work or anything? Please feel free to share. Laura, you have any questions or?
I haven't got any questions in the chat, but I am curious for the folks on the call, how far you've got logging into HARP. Have you been able, you know, I know the email came out after our last data submission. So since then, have you got into HARP and are you able to see these screens that Robin has here? And I can unmute everyone if it makes it easier if you're trying. I'll just go ahead and unmute everyone. So yeah, feel free to blurt out if you have or have not logged in and how far you've got looking at screens.
Robin, this is Emily, I was able to get my HARP account, but it would not let me submit last time with the HARP account.
Did you submit with the other account, or were you just not able to submit?
I went through QualityNet and did it that way.
Okay, so
the old way.
I'm sorry, the old way?
Yep.
Okay. I'm guessing now, because I would say always try it. You know, you guys always, and I do understand it's very frustrating that, and nobody has time to do it 15 million ways, but if one way doesn't work, try the other. What you always can do is run that case data summary report to see if there's data in there. But my thought is, we might no longer be able to do it that other way. This might now be the only way. And could you tell me, if you know, or where was it in the point with the HARP account that you that the data didn't get accepted? Did you go through going through all of this and it didn't, or did you even get to this far?
I couldn't even get that far. I logged into HARP and I got to the login. I accepted my login, and that's as far as it would let me go.
Okay.
It wouldn't even let me get to anything else.
Okay. Well, you know, I get it, because let me tell you, I mean, when I couldn't get past accept, that was like pretty frustrating. But I would say, if you can, even if you're not ready, you know, you don't have your data, you haven't abstracted yet, see how far you can go now. Try logging in and see if you can get to these screens.
Okay. My problem right now is the cart upgrade or update that they did. I'm not able to get it downloaded. So I've been contacting QualityNet, but I'm still waiting for them to contact me back. So they put me a case study, or I have a number out, but they have not done anything else.
So I don't mean to sound this way, but all you were trying to do was get like the next version of cart.
Yep.
And they can't even seem to help you with that right away. Okay.
Nope. They have to send, what they told me is they have to send it on to was it a specialist or a higher level?
Yeah.
I don't remember.
Yeah. I get the impression, and no one has told me this, but and you guys who've probably called QualityNet will agree, it kind of sounds like these days the person who answers the phone maybe will know the basic stuff, but almost all the time they have to bump you up to like another level or whatever.
Yeah, that's exactly what they told me.
Okay, so even if you're waiting on the cart stuff, Emily, is that who I'm talking to?
Yes.
Okay, Even if you're waiting on the CART stuff, Emily, try logging into the HARP account again and see how far you can get. See if you
Okay.
can get further this time, because if you can't, that's one other thing that we got to be working on before, you know, that due date. So try this again.
Okay.
We did have a comment in the chat from Christine Kirkin-Guyman that, let's see, that she was, wait, hang on, sorry, I jumped ahead. That she was successful in getting some data submitted. Yeah, I was able to
Yay!
do the new part, but it took several tries. It took a long time to get the production files to come up. It took several minutes to get off of the test files to the production files, but she has got 2 successful uploads in there.
Okay.
And so I wrote back and asked which browser she used, and she thinks it was Firefox.
Oh, okay. Now I haven't heard anything about that one. So as long as, again, you know, I'm sorry to sound like a broken record, guys, but imagine going through all of this and not thinking that your cases have been accepted, and they're not. So even if you go through all of this and you get this email, I know I'm scrolling fast, but you get this email, don't just take this email. Run that case data summary report, because the only things that's going to be on that case data summary report is the number of files that were submitted to QualityNet and if they were accepted and rejected. And for some reason, sometimes this email that you get does not jive with that case data summary report and what is actually been submitted to the warehouse. So make sure that you do that.
Has anyone,
But,
sorry,
oh yeah,
has anyone
no, go ahead.
all been able to get your population and sampling data in by chance?
Laura, I did it the old way.
You did the old way? Okay.
Okay,
Yep.
now person who just said that.
It's Emily.
Okay, oh Emily, when you said you did it the old way, that was back for last quarter, right?
Correct.
Okay, yeah, I'm kind of wondering, that's why I was really trying to get screenshots. I think in this new system, I don't know if that grid is going to be there. You know, does everybody know what I'm talking about when you're doing your population sampling and you had that grid and then you put in the numbers? I don't know if in this new way, it's going to be able to be done by that grid. No one can seem to tell me that. And again, I haven't been able to get screenshots. So that might be another area where log in, you guys, just even if you don't have the data yet, see what some of these screens look like. And if I can get some information about what the population and sampling screens look like, I'll make sure to get it out there to everybody. But as of now, I haven't been able to get that.
Robin, not to jump way too far ahead, but is it quite possible when May 15th rolls around 2021 that the web-based measures, that tab is where we'll be submitting outpatient 22?
Yes.
Okay.
Yep.
I hope there's a video by then.
I hope so too. I'll have to tell you, I was on a call, and it was with the CMS contractors for reporting support, and they had some person on from QualityNet who was talking about supposedly it's just having this whole big refresh this year, and you know, talking about this and that or whatever. And then they asked if there were any questions, and I was the only one. I'm like, well, this is all fine, but when are we going to get instructions on what things look like and screenshots or whatever? And he was like, well, you know, the pages kind of change day by day. And I'm like practically screaming in the phone, like, well, that's all fine, but people have to submit. And so nobody could tell me when anything might come out or whatever. So I am trying, because again, I just can't imagine like how frustrating this can be. And I'm not a techie person. As you could probably just tell when I was trying to type in my password and stuff. I need instructions. I need click on this, it's going to show this, you know. I can't just click on some of this stuff and it's just not intuitive to me. I just don't have that kind of background or whatever. So I need to have like more instructions, but I don't know. I mean, his excuse was that, well, they haven't put anything out yet because it keeps changing. well, then maybe they shouldn't have changed anything for us until it was like totally done. That was like my answer. But then they went on to the next topic. But anyway,
We have a couple.
yeah.
Lindsay,
Oh, go ahead, please.
Lindsay, I unmuted you. Can you hear us, or Lindsay Zimmerman?
Can you hear me?
Yes.
Okay. Yeah, I was just going to say I logged in to HARP, and I can see under the chart abstracted where the screenshot that she showed us, mine doesn't have the ECQM on it, but it has the other ones. And if I click on chart abstracted, it does give me the production and then to select the files.
Okay.
Hey, Lindsay,
Okay,
would you mind clicking on population and sampling and taking a screenshot of it for us, though?
Yeah, I will. I can.
Awesome. And then Blake and Cordell said that he's following along in HARP, and he did not get an option to select OQR after selecting production.
Oh.
Like, I'm gonna unmute your line. Maybe.
So like you didn't get to like you didn't get this right here?
Oh, I can't get him unmuted.
This is Lindsay. When I got in there and clicked on the data form, like what you were just showing, it only gave me IQR. It didn't give me the other one.
It didn't give you OQR?
No, and that's what he's saying too.
Well, that would be upsetting since pretty much there's only outpatient, we're only submitting outpatient report right now.
Do you want me to screenshot that and send it to you too? Production.
Okay, okay.
That's what that is.
Okay. So, and you know, so maybe you guys have to a little bit play around. This was the screenshots I got from this person who was doing it, you know. And so maybe she had a little bit different options with this, because I think someone said they didn't have ECQM.
Yeah.
So this is great, you guys, and I think what it's really kind of showing everybody, I hope, is that again, you might not be ready yet to submit your data, but go in here and see what these screens look like for you, and make sure that you're being able to get to some of these things at least this far. Because if you can't, then when it comes time to submit your data, you know, you don't want to be trying to call QualityNet then with everybody else who might be in that same boat, because maybe you won't get through.
Hey, Robin, it's Emily. I did log in through HARP just now, and I clicked on the population sampling for Q2 2020, and it does have that grid.
Oh, it does?
Yes.
Well, that's a good, well, I'm very happy about that.
Yeah.
Because that was not my understanding, but that's great. That's great. I thought people were going to maybe have to submit it via a file, and I didn't know what that would entail. So that's why I wanted to see what options were for people. But because I don't know that everybody would know, or I wouldn't know how to do a file on those numbers. So okay, maybe that won't be changing. So thank you for sharing.
Can you also walk me back through on how to get to this page here?
Which page?
Because I'm under, see, mine still looks like the old QualityNet.
Looks like this?
Yeah, that's where I'm at.
Okay. What happens if you click here? View the new hospital quality reporting. Click on that.
Okay, got it. Found it.
Okay.
Never mind.
No, this is really good. And I really appreciate you guys. I feel bad that I'm like having to say, hey, this is all I know, help, you know, whatever you guys can share. But I'm honest with you. That's the truth. This is all I've been able to find out from people. So I found this really helpful, and I hope that you guys have at least, you know, being able to talk through some of this or whatever.
Okay, well,
Anybody have-
with that being said, on the population and sampling, it's not the same. You're right.
Okay, so you clicked on down here?
Yes.
Okay.
And I'm in production, and it just says drag files here to upload or select files.
Okay. All right. So what we're not sure of is like you were still able to get into it to the old way, but if you submit it that way, will it, is that still okay?
Okay.
And so, I don't want you to think either, you guys. I don't have any trouble like calling QualityNet and asking these things. What happens is the first thing they ask me, even though I've been calling them for, I don't know, 15 years now, and they've got all my contact information, they'll say, and what hospital are you with? And I'm not. And I tell them over and over and over. And so then they're like, well, click on this and what files are you trying to submit? And I'm like, I'm not, I'm just trying to get information. So sometimes it's better if the hospital calls, because then you are the hospital and you've got a file, where they kind of, I get a little bit stonewalled sometimes because I'm not a hospital, but you guys are. And that's the only reason why I say, hey, it's better sometimes if you call them rather than myself, because it's sometimes then a third person, and they can't seem to function sometimes by understanding that I just want instructions to help people. So,
Hey, I do have a question. If we do it the old way through the population and sampling, and it lets us do that, how do we know if it's accepted the population and sampling?
I don't believe there's any report that you can run that shows that.
Okay.
So really you'd have to, if I think when you submit it, does it say like if you click, is it submit or save or something? You might have to call the help desk and have them see if that data is there.
Okay.
And I would, if I can find out, is that Emily again?
Yes, it's me again.
Okay. Emily, if I can find out something different or more information about that, I will pass it on to Laura to give to you guys. Okay.
Okay, that'll be great.
I'm sorry. I know that I'm probably going past the time. Does anybody else have any questions? Again, I hope this wasn't more confusing, but it was just the information that that we've got out there now, and maybe in a week, in 2 weeks, sometime in October, like QualityNet CMS will have like maybe a webinar or a presentation or something that we can look at that will help us more.
We did get a question, Robin. Do these have to be submitted as zip files or just directly off your computer? Is there anything different with the file that needs to be submitted?
I don't think so, because it looks like when I was, this person who was helping me, when she kind of did it, it looked like she just did files like she did before. She didn't say that she had to do it in a zip file way.
Okay. All right. Well, does anyone else have any questions for Robin? This has been really good. Okay. And I know Lindsay sent me a handful of a few screenshots, so I'll get those to you, Robin.
Okay, I really appreciate that, you guys. And again, if and when I learn anything more, anything that hasn't come out like in an email from QualityNet or whatever, any like secret things I find out because some hospital told me they tried this or that, I'll make sure and share with Laura as well. But if anything else comes up, you can always try me first, just because I'm probably going to answer you sooner than maybe the QualityNet. But if I don't know, I'm sure going to tell you that. Or if it's like, oh gosh, sorry, you're going to have to call QualityNet or whatever. Just my recommendations would really just be for this quarter, as soon as you could try to submit, do it. And then because you just don't want to wait until the end in case you're having problems and you know, a lot of people are calling QualityNet.
Yes, and if you guys want to share your experience, you know, let me know what your experiences are while you're submitting. I'll definitely share them with Robin, share them with other facilities. And if you run into headaches, I'll definitely forward it on to Robin, but stay in touch with our other facilities submitting data as well. I will say we had, when was that virtual knowledge group call, Robin? Was that in August?
Yeah, I think that's when the last one was.
Robin was adamant about our experiences that we had, sharing that and with the Federal Office of Rural Health Policy, that this was a major hiccup for folks. So they are in the loop, they are in the know of our struggles as well. And so Robin, I'll definitely stay in touch. And, you know, as soon as we hear something different, I'll be sure to forward it out to everyone. A couple things that I wanted to draw everyone's attention to real quick. Robin has office hours. Is it once per quarter or every other month?
Yeah, it's usually, yeah, I think it's quarterly. The next one was in October.
Yeah, October 22nd. And you do have to register to get the call-in info, but it's an opportunity to meet with peers across the country to ask questions about reporting. I'm sure HARP will be discussed at that time as well. I'll send out the registration link again. And then also abstracting for accuracy with Robin. And that is an ongoing application process, right?
Yes.
Okay. Again, great program, great opportunity for those who are, if you're new to abstracting or if you've been abstracting for several years, it's a great opportunity to kind of like finely tune and have another set of eyes look at what we're working on. Thank you guys for your time, and thank you, Robin, for your expertise. Again, if you guys have run into any questions, please let me know. Just like this HARP one, we were all having the same questions, not just us, but across the country. So please, yeah, please let me know. And thank you guys for your time. I will send out the PDF that Robin was sharing with the screenshots, as well as Lindsay's presentation. And then the goal is to have this recorded and posted online, and I'll send that link out at a later time. So thank you guys for your time, and everyone have a good day.
All right, thanks everyone. Bye-bye.